According to research from Johns Hopkins Medicine, nearly 10% of American adults suffer from depression and anxiety. Therapy and medication can help, but about a third of those patients will not respond to traditional treatment. But as Spectrum News 1 reporter Christian Jirah found out, a treatment center here in our state is utilizing ketamine therapy and says it can help.
When's her meeting? 8 o'clock in the morning? I'm just messing with you.
Veronica Sutherland and Thawanda Peterson were nurses in the same hospital.
Our lab?
Veronica left to start a wellness center.
Prettiest lab in Charlotte-Mecklenburg County, I think.
That included pain management and beauty treatments. But she also wanted to offer more for her clients' mental health.
I picked up the phone and was like, hey, can I run something by you?
She wanted to offer ketamine therapy, and Thawanda is a certified registered nurse anesthetist.
So who else was I going to call except for the person who does it every day, who has absolutely a wonderful personality, who has integrity, and I like as a person.
And here we are.
And here we are.
And you called me and you said to me, hey, don't tell me no, just think about it. And in my mind, I've thought about this 100 times already, so it's perfect.
So about a year ago, Thawanda left the hospital and set up her treatment area at FLO Hydration and Wellness.
Administering ketamine infusion therapy to patients to assure that there's some type of hope and purpose added to their life.
Thawanda said traditional medications for depression and anxiety work on serotonin receptors in your brain. Ketamine targets a different receptor called glutamate. She tells patients to think of the receptors like lights in a city.
Think of New York City, okay? This big, bright city, and as neurons and brain cells began to become more damaged over time, the city lights began to become really dim. Ketamine comes in and it repairs the neurons in the brain. It actually stimulates neuron growth. So as that happens, little areas in the brain become more lit, so that what was dark city begins to have more light.
Patients get 6 ketamine infusions within 2 to 3 weeks.
So safety's first.
Patients are hooked up to a monitor reading their heart rate, their oxygen levels, and also keeping track of their blood pressure. You get a dark room, earplugs, and a mask. Because with ketamine therapy, you can feel like you're floating, see things moving, and also feel a little nauseous.
All of those dissociation type side effects are perfectly normal, and it tells us that the ketamine therapy is working.
And if it's working, Thawanda said the results can be remarkable.
Patients can find relief from their depression within minutes after their infusion. And then not only is it just fast acting, but it also lasts for days, months, even several months after their infusion, they get relief from depression.
Christian, thank you for that story, and that animation was really telling of, I guess, how it would work. You know, I'm such a visual person, and seeing the darkness of the city and then the lights kind of popping back up one by one gave me a pretty good idea of how that could work.
Yeah, it really did hit home there, and I guess it is a great thing if it can help people who have depression. Ketamine therapy, by the way, is just one of the options that the Mayo Clinic lists as a possible way to manage treatment-resistant depression.
Talk to your medical care provider about your options. You can also find more information on our website, SpectrumLocalNews.com, or on the Spectrum News 1 app.
And the app is available to download wherever you get your apps.